Oh, can you hear me? Can you hear me? Am I audible?
You are audible.
And my visuals are fine?
Right, the visuals are fine. Good afternoon, you all. My name is Dr. Fundi Lenyati, otherwise called Dr. Fundi. Today, we are having a live broadcast. We are hosting one of the brilliant young South Africans, Mr. Mohammed Hussein Suleiman. Now, I just want to share a little bit about who Mohammed Suleiman is. He's officially counted amongst South Africa's top 200 young South Africans. He's also one of only 3 medical students worldwide to have received the prestigious Changemaker Scholarship for the World Health Organization Convention in May 2022 in Geneva, Switzerland. He was a delegate to the World Health Assembly in Geneva in both 2022 and 2023, representing South Africa at the WHO headquarters. He is currently pursuing a Bachelor of Medicine and Bachelor of Surgery undergraduate degree at the Nelson R. Mandela School of Medicine, University of KwaZulu-Natal. He's a dedicated youth leader with a core focus on health advocacy and health development, particularly in resource-constrained settings like sub-Saharan Africa. He attained his Bachelor of Pharmacy degree with honors at the UKZN in 2018, graduating as a top student, with summa cum laude. That's like excellent kind of, academic performance. He attained distinctions in every module in every semester. In the same year, he received the 50th Anniversary Endowment Scholarship Award, which is awarded to only one student in the College of Health Sciences at UKZN and is based solely on academic merit. In addition to being a high-level academic achiever, Mohammed is furthermore a devoted community servant, an avid public speaker, and an advocate for change. He is also an editorial board member of the International Journal of Medical Students. He is also a student clinical researcher at the Center for AIDS Program of Research in South Africa, commonly referred to as CAPRISA. He participates passionately in the academic research, working closely with South Africa's leading scientists. More recently, he was awarded the South Africa Health Excellence Rising Star Award and is now awarded the 100 South African Shining Stars taking place in Joburg next week. Mohammed retains a key interest in developing innovative ideas that progress existing processes and systems, believing that it is imperative for future leaders to rigorously engage in order to advance pioneering and development-oriented ideas. Mohammed champions the fundamental principles of Ubuntu. I am because you are. And Umuntu ngumuntu ngabantu, meaning a person is a person because of other people. I am because you are, and you are because we are. So, ladies and gentlemen, let's welcome Mr. Suleiman, who is joining me from Durban. He will discuss with me, his journey, high school, university, pharmacy, and what made him to actually decide, I want to be a medical doctor, despite the fact that I've actually aced the pharmacy degree. So, Mohammed, welcome to Dr. Fundi Channel.
Thank you so much for this invitation, Dr. Fundi. It's an absolute pleasure to be here with you, to be speaking again with you. We've had a few interactions in the past. I'm truly inspired by your work, and I'm truly honored and privileged to be speaking on your platform with you. Thank you once again.
Lovely. So before we get to the serious stuff, of the big things that you are doing, just tell us a bit about you, the family you come from. Are you a firstborn? Are you the lastborn? Are you a middle child? Just tell us a bit about your family.
Sure. So I come from a rather large family. I'm the second lastborn. My parents, or rather my father, has a history in business.
Yes.
I have a younger sister who is actually a fifth-year medical student, interestingly. We are in the same class.
Yeah.
We actually, we try to study together as well. I was born and brought up in Durban.
Yes.
I hail from the warm city of Durban. I schooled at the Hillary Primary School in my primary school, and then I went on to the Orient Islamic School that's in Durban. I matriculated in 2014.
Yeah.
I then pursued a pharmacy degree, which is a 4-year degree with honors.
Yeah.
I graduated in 2018. I then went on.
Let's just hold it there. When you were at high school, what was your first choice in terms of the health professions? Was it pharmacy or was it medicine?
Interestingly, none. I wanted to pursue a career in engineering. I was always passionate about mathematics, about physics. And even with my colleagues, my classmates, they had always thought or believed I would be pursuing a career in engineering or in actuarial sciences. And I think it was by chance I had come into the health science space.
Yeah.
So to answer your question, it was actually none.
Yeah.
But I think in hindsight, I'm glad to be where I am.
But what stopped you from pursuing engineering?
So I was doing a little bit of homework. I had consulted at various levels with engineers, with people in the industry. And I found that the scope may not necessarily, how could you say, be inviting or be appealing to a matriculant to enter the space. I was counseled, I was advised that if one were to excel in this kind of discipline, they ought to travel, they have to move abroad.
Yeah.
And there was a sense of hesitation, of reluctance to go down that path. Yeah.
Yeah. Okay. So that was basically a choice based on the feedback of the people who have been, in the field of engineering before.
Yes. And I think it's always important that as the youth, as young people, as students, we seek advice from our elders. We seek advice from the experts. And simply put, that was my intention, to counsel,
Yes.
seek advice, to seek some kind of guidance
Yeah.
on this important topic of my future endeavors, my academic future. And and it's so important that you ask that question, that based on the advice received, I did not pursue engineering. And
Yes.
so it's so critical that indeed the advice, the guidance, I mean, even till today, as a 50-year medical student, I regularly seek counsel and advice from my elders.
Beautiful, beautiful. In the African, culture, there is a proverb that says, "Inyati ibuzwa kwabaphambili." Simply put, um, when you are in the felt out there and you are hunting and you want to know where is the right way to go, sometimes you have to ask the more experienced hunters to give you guidance on how best to corner that animal that you want basically you are hunting. So that animal that you are hunting. So basically that old adage applies even today. So what you're doing in seeking guidance from those before you is actually good wisdom. But also I think for the health professions, it's also very good, because then that mind, of thinking out of the box, lateral thinking and everything that is normally one of the requirements in the engineering space, you're going to bring it to our health profession. And I heard you, earlier you were talking about looking at innovative solutions, and we definitely need people who can think out of the box, in the health professions. So I'm happy about that. All right, so you got admitted to do pharmacy at the UKZ and Department of Pharmacy, right? Tell us about that 4 years.
It was a 4 years of intense work. It was a 4 years of commitment and of dedication. In fact, when I look back, I think a lot of my thinking, a lot of my, and please forgive me, or rather at the risk of sounding immodest,
Yeah.
is that a lot of the maturity that I intend to display now in the medical field was actually built from those 4 years in the pharmacy curriculum.
Yeah.
It's that mature mindset, it's that that experienced mindset that you bring to the clinical setting, that you bring to your research endeavors, was built on the foundation, or rather the foundation was created in those 4 years. And it's interesting you asked that. I actually recall in my third year of my pharmacy degree, my final exams, I remember it was the pharmaceutical examinations that we were writing.
Yeah.
And if the viewers are in the field of pharmacy, the code or the module name was called Pharm 352, which we were being lectured by Professor Varsha Bengali. I recall for exactly 1 week being confined to the 4 walls of my room just to prepare, for that examination. I was truly dedicated, to my studies. My absolute priority was number one.
Yeah.
And to have now built on that foundation, to have built on that kind of mindset that you have in academia, it has been truly wonderful. Furthermore, to build on that connections, I think I've established a wealth of connections, a wealth of knowledge that actually emanates from those 4 years.
Yeah.
And if I could quickly share with you, a quotation that I hold quite dearly to me, I try to inculcate with your permission.
No problem.
Dr. Peter Owira was the lecturer in pharmacology, a close colleague with the legendary Professor Bongani Mayosi. I'm sure you are very well, you are well acquainted with Professor Mayosi.
Yeah, he was my classmate.
Yes, yes, absolutely. So Dr. Peter Owira, in 2018, when that sad news had come out on the passing of Professor Mayosi,
Yeah.
Dr. Peter Owira had been counseling us, had been advising and educating us, not only teaching us the core curriculum of pharmacology,
Yeah.
but sharing advice on life. And he said something
Life.
so profound. He said that the university is not a place for teaching and learning.
Yeah.
Rather, it is a place for the acquisition, regeneration, and dissemination of knowledge. How truly profound a quotation, whereby if you truly understand what he means by that, you'll understand the value of the university life.
Indeed. Indeed. Yeah. Now, just tell me though, did you have any life during the 4 years? I mean, you were acing every module, every subject, summa cum laude. Like, just tell us about that. It sounds like you did not have a life at all for 4 years.
I think in those 4 years, one could reliably conclude that indeed that is the case. I had no life. I was not going out a lot, but perhaps in the holidays, it's important you spend quality time with your family, your
Yes.
friends, your loved ones, your close ones.
Yes.
And I think in the spare time that I would try to find, I would be spending it
With
in
family.
in the quality time with family.
Yes. All right. So clearly you were the toast of the 2018 class of, the pharmacy class. And then you don't go and practice, that profession. You then decided, no, I want to go and do an MPCHP. I want to do another undergraduate degree rather than a postgraduate degree. Why?
You know, Dr. Anyati, I was accepted for internship in the pharmacy degree, in the pharmacy discipline.
Yeah.
I had started my internship. I
Yeah.
completed, I think, the first 23 days, and I recall quite clearly it was the 23rd of January 2019
Yeah.
when I had received that call of my acceptance into the MBCHP program.
Yeah.
23rd of January. I then had 3 days
To
to
decide.
make a decision if I want to accept the offer.
Yeah.
And at this point, I was undecided. Should I accept the offer, go back to undergraduate um, studies, or do I continue in the pharmacy discipline? I have 3 days. I then consulted with my elders, with my seniors,
Yeah.
and it was 3 points that were put to me that had made me to decide to pursue MBCHP. One, they had advised me I'm still young.
Yes.
Two, it's home
Yeah.
because it's in KZN. And three, the the opportunities from MBCHP program are multifold and are never ending.
Yeah.
You know, um, I mean, why not pursue that path? And on those three solid options, on those three strong points, I then decided to pursue this path.
Okay. And so you joined in. Did you join in at first year or join from second year?
From first
MPCHP.
year, yes, at UKZN, they do not have what we call the graduate entry medical program. That's a program,
Vets
a
has got that.
project. Yes. That is a project happening at Wits University in Johannesburg.
Yeah.
And at UKZN, if you accepted, you must go into first year.
Okay. So back to first year, dissecting, what are the rats and what's the fish? I've just forgotten what it is now. But we used to dissect the rats and some other fish, tracing the nerves. So basically, you started there, back to the bottom.
Yes, absolutely. So in first year, it's more of a general year. It's
Yeah,
more, if you look at the health sciences curriculum,
yeah,
and particularly at UKZN, it's kind of general. You do your your basic sciences course. You do isiZulu, which of course it is mandatory. And you do also a little bit of community work.
Yeah.
That's called, it's the Making a Difference project that was
Okay.
incorporated at UKZN.
Yeah.
So first year, you're not exposed a lot to the clinical setting, one.
Yeah.
Two, you are not dissecting.
Okay.
Yes, you focus on theory, but the actual theory of anatomy and physiology
From
commences in your second year.
yeah. All right.
Yeah.
No, during our times, our first year was like more of a general BSc training with a bit of biology. So I think things have changed since the early 80s. All right, let's move on. So you joined in, and if we look now, you've just finished your 5th year, right?
Yes.
All right. So how has this period been for you? I mean, you're doing so many things, but you are excelling in all of them. So how has this period been for you?
You know, it's been a wonderful journey, truly. We we have lived through probably one of the most difficult times in the last century, the
Y-
COVID-19 pandemic.
Yeah.
Um, and actually coming from the lockdown, coming from those lessons, you know, when we always speak about the pandemic, we always focus on the negativity. We focus on the negative aspects and the lives that have been lost.
Yeah.
And what, but I think it's key that we ask ourselves a critical question. Is there any positivity we can take out from the pandemic? What good can we take from this pandemic that now can drive us for our future endeavors and goals? And
Yeah.
for me, it was truly to establish that relationship with a lot of members, and I'm sure you are quite familiar with them. Probably
Yeah.
some of your classmates, those who serve on the ministerial advisory committee
Yeah.
that that was ultimately advising our Minister of Health and the President.
Yes.
Um, that journey has just now opened up this uh, how can you say, this door of opportunities. You
Yeah.
know, when you open one door, there's 10 more doors behind that, and
Yeah.
there's 10 more doors behind each, behind each other one. And now to establish that relationship, especially at Caprisa,
Yes.
Professor Dlova, who I know you are quite familiar with, is the
She
medical
was she
school
was my
dean.
classmate as well. I'm the one who was lazy to study, but Bongani and Glover, they decided, no, what, they want to go further in the academics, and I loved money too much, so I took a short road.
Yes, I'm actually just reminded by the first conversation I had with Professor Dlova
Yeah.
in October 2019, and I'm not sure if she actually remembers this. I must ask her. So I had arranged a meeting with her in my personal capacity.
Yeah.
I had sent an email with a short motivation. Can I have a meeting with you? I was then afforded a meeting after 1 week, and I
Yeah.
enter her office and I say, "Wow, Prof, I've been actually anticipating this moment for the last few months,
Yeah.
and you have reached, the highest level of academic excellence." And in fact, this meeting was inspired by a groundbreaking study that she had done to
It's
investigate the
on
gene.
alopecia.
Absolutely,
Yeah.
absolutely. It was on centrifugal alopecia.
Yes.
And she was leading the study that had discovered the gene that causes
Amongst
CCA
black
in
Africans.
African women.
Yes.
African women, absolutely. And when I told her, Prof, you've reached the highest level of academic excellence, it will suffice to say, where you are, I want to be there one day. And she was
Yeah.
in awe. She loves the students. She
Yes.
loves the youth. She gets very excited
And is very
when
proud of
students,
you.
I hope in the little I can do, I will inspire confidence in my mentors, in my elders.
Mm.
I hope to
Mm.
be making them proud. I hope to be half the person they think I can be.
Yeah.
And to be under her wing, to be under her tutelage, her mentorship is truly remarkable. And that was my first meeting with her. We started off our journey,
Yeah.
and we've got 4 projects,
Yeah.
looking at dermatology, looking at alopecia,
Yeah.
and our recent project we just concluded with the data collection. The results are sitting in Germany with the analysis, and we'll be undertaking the write-up. So in essence, this in brief is my journey. Yeah.
Yeah. Yeah. But now I just want to go back to something that I thought I was going to ask earlier. You joined MPCHB already being a graduate, an undergraduate, you got your pharmacy degree. Now, when you were in the same class with people who've just come from high school, what advantage did you observe? The fact that you already experienced, being a graduate compared to the guys who had just joined in straight from high school?
Well, to be honest, quite the opposite. I think I was a little fatigued. I was a little tired, and perhaps a little bit of laziness. And, to approach these academic experts just instilled in me a sense of, how can you say, reinvigoration, you know,
Yes.
um, stimulation,
Yeah.
right? Sparking interest, promoting academic excellence, promoting, if you look at the UKZN, the foundational principles that we speak of, it's called REACH, T principles.
Yeah.
R for respect, E for excellence, A for academia,
Mm.
you know, integrity, honesty, trust, fundamental principles that you ought to hold most dear to you.
Yeah.
And I think that was actually sparked by my mentor. So I
Yeah.
don't think I had, in a way, an advantage. Perhaps the only advantage, and I spoke about this earlier, is the maturity mindset
Yeah.
that you bring.
Yeah.
Um, I think that mature mindset, that willing and urge that comes with it to pursue the academic excellence and attempt to pursue academic excellence, I would say was a strong point for me. Yes.
Lovely. So now let's just get to the stuff outside of the serious varsity work. Involvement, in global issues as a medical student, and how you got to be one of the people to represent South Africa at the World Health Assembly 2022 and even this year. Can you just tell us about that? How did that come around?
It's quite a loaded question and a very interesting one, I might add. My work and involvement with the WHO had begun in the year 2019. A colleague and I worked on a project on antimicrobial resistance, and we had submitted, you know, um, uh, we had responded to that call for applications. We submitted it. There were experts from the WHO, from the Johns Hopkins Bloomberg School of Public Health in the US, and a lot of other experts. I think 15 experts on antimicrobial resistance worldwide. They
Yeah.
sit on that panel.
Yes.
They shortlisted us for presentation in Geneva at the World Health Organization headquarters,
Yeah.
and ever since that journey has now unfolded. And as the medical youth delegation, which is now headed by the WHO Youth Council, the International Federation of Medical Students Association. So,
Yeah.
as you know, the WHO Youth Council is an endeavor that was put forward by the Director General himself, Dr.
Yes.
Tedros,
Yes.
and the members of the Youth Council speak directly to him representing the views of youth.
Yeah.
Now, the Youth Council and the IFMSA, they take a delegation every year to the World Health Assembly
Yeah.
in Geneva. And they shortlist, they select representatives from different countries worldwide. I'm fortunate, in the last 2 years to be shortlisted, to be invited as a delegate,
Yeah.
to be representing the country to speak, in official capacity, the views of the medical youth fraternity, not only
Yeah.
in the country, actually,
Yeah.
on the continent and the world at large. So the IFMSA is a body of of students that actually speaks on behalf of 1.5 million medical students
Yes.
across 139 countries worldwide.
Yeah.
And it's truly an honor and a privilege to be there. I mean, I'm sure you'll agree with me. It is the dream not only of a medical student, but of a medical doctor to be
Yes.
present at the WHO, to be witnessing firsthand the discussions, the debates at the highest level about policy making, about decision making, about diplomacy, you
Yeah.
know. And quite interestingly, I had even met our Minister of Health, Dr. Joe Pashler, at the
Yeah.
WHO, and truly wonderful how this journey has evolved.
Yes. Wow. All right. So I just want to ask you about another issue as well. Changemaker scholarship for the WHO convention in May 2022, Geneva, Switzerland. Just a bit about that.
Yes. So the Change Maker Scholarship is a very, what I would regard as a prestige honor. And last year, three medical students globally were selected for the scholarship. It was me from South Africa, a colleague from Malaysia,
Yeah.
and another colleague from Pakistan.
Yeah.
Three medical students globally
Yeah.
were were bestowed with this honor, this prestige of the Changemaker Scholarship. And then
Yeah.
with that scholarship, of course, it's the funding opportunities, etc., that ultimately takes you to both the Youth Pre-World Health Assembly and World Health Assembly. And
Yeah.
spending uh, just over 2 weeks in Geneva, interacting directly with experts from the WHO. Um, I mean, it has been truly remarkable to listen at, I mean, firsthand, you know. And interestingly, this year at the World Health Assembly, um, the Director for Health Promotion
Yeah.
at the WHO, Dr. Rudiger,
Mm.
um, I had a direct interaction with him. And from that interaction, he tells me, Mohammed, you are actually feeding into the 2063 agenda for public health or health
Yeah.
promotion. I was
Yes.
putting to him an idea that had come about in the discussion on smoking cessation.
Yeah.
As you'd know, smoking is probably one of the greatest threats, you know, to health promotion, to disease promotion, amongst the others like obesity
Yes.
um, and uh, and the range of other comorbidities. Now,
Yeah.
smoking cessation, we know tax implications. We know other measures put in place by government to stop smoking.
Yes.
In two countries, this has actually worked. I believe the Philippines, and it was one more, and it has slipped my mind. And in that, I put forward an idea about QR coding and how we can bring this innovative idea for smoking cessation. If you're a smoker, you need to declare to the public health authorities. You will then be assigned a QR code. And when you go to purchase the cigarettes at the store, they will then scan that QR code that is unique to you. You are limited maybe for one pack per week or per month. So it's an idea in
Yeah.
so it's just in brief that I'm putting to you and to the listeners. But of
Yeah.
course, there's a lot behind it that feeds into this idea.
Yeah.
And what had actually, stood out for me, you'll find and I think you'll agree with me, as the young people, we are too scared to speak about in the room of experts.
Yeah.
We're too scared to share our points openly. And what I found is that really don't be scared.
Yeah.
You'll be surprised how it will be received on the other side. This is a prime example.
Yes.
Um, I mean, it was just
I mean, what are the
spontaneous in a
chances
way.
of you actually interacting with the person who's driving that agenda of health promotion globally? I mean, the chances are little. And yet, when you have that opportunity, you must make the mark.
Absolutely, absolutely. And I was sitting in the room. I just lifted my hand. They had recognized me. They had passed on the mic to me, and I just spoke openly. I just spoke my mind. And we're sitting in the room. It was the side event of the World Health Assembly,
Yeah.
probably in excess of 100 to 150 of of experts, of public health specialists from around the world. We're
Yeah.
talking about advisors to different ministers of health in different countries. We're talking about the government officials, right? And even a few of the ministers of health themselves. I had, you know, I I also had an interaction with Minister of Health of Kenya,
Yeah.
and I was truly inspired. In fact, more than anything, I wanted to know his age. This is a guy, when you look at him, just by mere physical appearance and
Yeah.
sight, you are inspired, you are confident, young, energetic, and vibrant. And really, you know, to have learned so much, to be a recipient of the Changemaker Scholarship, being invited to the WHO, has really, how can you say, broadened my mindset, my horizon, and
Yeah.
has really brought on this kind of energy and interest in public health.
Yeah.
Yeah, and I mean, I hope I can bring a little
Yeah.
to improve the situation in South Africa, to
Yeah.
be making some small contribution.
Yeah. We're going to get there. We're going to get there. Now, the last thing I want to ask you about from a global perspective. You are in the editorial board as a member in the International Journal of Medical Students. Tell us a little bit about what does that mean? What do you actually do, to contribute there as a board member?
So on the board there are two South Africans, a neurologist from University of Cape Town,
Yeah.
and it's me from the University of KwaZulu Natal.
Yes.
And as um, the submissions that are made to the journal, these are scientific articles, scientific submissions, are then made to the journal, and the chief editor will then assign a paper, an article to the different members to
Mm.
be reviewing, to be scrutinizing, to
Mm.
critique, those kinds of articles and the submissions.
Yeah.
And on average, one article every 3 weeks, and in some cases every 4 weeks, will be
Yeah.
sent to the members of the editorial board to scrutinize, to find, it's to apply scientific rigor,
Riga.
to apply, how can you say, critical analysis to the submissions that are made. And
Yeah.
in essence, this is my involvement, my work with the
Over and above
International
being
Journal.
a medical student. All right.
you know,
Yeah. Now let's move
it's
on. We've got
yeah.
about 22 minutes left. All right. So you are working within the Caprisa, led by our renowned prof, Abdul Karim. We used to call him Slim when we were still students. How is it that you work under somebody like that? What advantage or, what inspiration do you get? I mean, somebody who is at the forefront of, cutting edge research on matters of HIV and AIDS.
It's so interesting that you asked this question. Professor Slim Professor Salim Abdul Karim is really a giant in medicine. I was interviewed on radio just yesterday, and it was sometime last week, and I even spoke about him. 29th of March 2019. I will never forget the day. I'm a first year medical student. Professor Abdul Karim comes to address the first year class. Now, it's tradition, it's culture for Caprisa and for him to come and speak to the medical students and invite them to join Caprisa. Caprisa has a research placement program where they assign mentors to the medical students, encouraging them to be involved in research. He addresses the students and he just leaves to his office. I sneak out from the back of the boardroom,
Yeah.
and I chase after him. His PA, Norma, I plead with her, please allow me 20 seconds. I want to say hello to Prof. I'm inspired by him. What's supposed to be a 20-second meet and greet turned into a 20-minute robust engagement. From that engagement, I took out fundamental principles. I call it CP3 or CP cubed, if you like. It's an acronym. C stands for curiosity, P1 passion, P2 persistence, P3 perseverance. These elements tie in with each other. And if you know Prof. Salim, even when he spoke with us, he says, and he shared with us a quotation from Sir Isaac Newton. He says, if I am able to see further, it is only because I'm standing on the shoulders of giants. Prof. Salim is a giant, both in the physical sense, in the figurative sense. We know his contribution to science and to medicine. Who better, to run after? Who better to be, to be under his wing? Prof. Qureisha as well, an equally accomplished expert.
Yes,
and,
in her own right.
Yes, absolutely. And, when I speak about CP3, C stands for curiosity.
Yes.
If you want to achieve something, you ought to be curious.
Yeah.
That's what drives your interest in science. You ought to ask questions all the time. Difficult questions. Then, if you are passionate, you'll be asking the right question. You'll be asking the right questions about your curiosity. If you are persistent, you will search and find answers to those questions. You will search. You will not give up. You will not allow failure to come in the way. And if you persevere, you'll find answers even if they are not there.
Indeed.
And essentially, in every facet of life, if one has to apply that formula, and this was sparked from that conversation. I don't think he even remembers that conversation because every day people are coming to meet him. But really, it was eye-opening for me. And in that 20 minutes, I was so inspired. Really, this is the highest level of academic excellence. A mentor, a role model. And I smile at him, and I say, Prof, where you are, I can only hope and dream one day I want to be where you are. He smiles. I'll keep the seat warm for you. And
All right, let's move on. So earlier, you mentioned something about antimicrobial resistant. Now, 18th of November to the 24th of November is the Antimicrobial Awareness Week. So my team here, we were actually we recorded a podcast around that matter, which is a serious public health issue where germs are getting to be resistant to a number of antibiotics. Not only antibiotics, but antifungals, antivirals, and protozoals and things like that. So I just want to hear from you. When you look at the fact that since the 70s, the number of new antimicrobials, especially antibiotics that are coming up, are far and few, something different compared to the 40s up to the 60s, which was the golden era of antibiotic discovery. So what are your thoughts around this matter, and do you think enough is being done to increase awareness about antimicrobial resistance?
When we speak about antimicrobial resistance, such a complex topic, and I think that's the reason why a lot of the students shy away from it. Even my observation in the clinical setting, when it comes to antimicrobial resistance, our understanding is very, very limited. Now, these microorganisms that we speak about, be it if it's a virus, a bacteria,
Yeah.
if it's a fungus, inherently they possess the ability to alter their structure, either the
Yes.
physical structure or the genetic makeup, the genetic composition.
Yeah.
As you know, these organisms, they have what we call the amino acid sequence.
Yeah.
20 amino acids form a protein. And ultimately, it's that growth, that propensity to grow that ultimately forms the organism or
Yeah.
the structure.
Yeah.
Inherently, they can adapt.
Yes.
They can
They have to
adapt to an
survive.
environment, yes, to survive. If we look at the theory of evolution that was proposed by Charles Darwin, we see
Yeah.
something like this, where, and I'm just reminded by the quotation of Professor Charles Darwin, if
Yeah.
you will allow me
Yeah.
to say it.
Yeah.
It's not the biggest that survives. It's
Is the,
not the most intellectual. It is the one that is most adaptable to
yeah.
change.
Yes.
These organisms have that ability to change. When we prescribe drugs, when we prescribe antibiotics for a
Yeah.
bacterial infection, even antivirals for a viral infection, we ought to be cognizant to maintain our drug levels above the minimum inhibitory concentration.
Yes.
This is the minimum level of drug in the
To kill.
blood to ensure we're keeping these organisms at bay. We're
Yeah.
preventing their replication. We know the process of replication when
Yeah.
it comes to mitosis, etc., the transcription and translation.
Yeah.
We ought to ensure that our drug levels in the body is in the therapeutic range, the
Yeah.
therapeutic window. These are some of the medical jargon that we use, in the laboratory, in the
Yeah.
hospital.
And my team here, they felt I was using too much jargon. So I was trying to use very simple language. I mean, beyond the name GEMS, they didn't know that, there's different groups and this and that. I even asked them to tell me, what the gems are called in their own languages, and some of them struggled. But anyway, let's continue.
In the different disciplines that we come from, right,
Yeah.
we have our own jargon. I'm sure
Yeah.
your people in the IT discipline have their own jargon. If you're an
Yes.
attorney, if you're an attorney, you've got your own language to which you communicate to your peers and to your
Yeah.
colleagues.
Yeah.
And equally in the medical field, we have this. And
Yeah.
and of course, we have to break it down. We have to communicate them into simple terminology so that the
Yeah.
message is delivered. So
Yes.
essentially, antimicrobial resistance really is one of the world's gravest and most serious
Biggest.
public health threat. It's
Yeah.
in the top 10. When you look at the statistics that from research that was published by the World Health Organization,
Yeah.
in 2050, if left unabated,
Yes.
it can cost the global
About 10
economy
million
in,
people.
yes, yes. So the global economy in excess of $2 trillion
Mm.
in terms of loss of life, as you correctly say, 10 million lives per
Yeah.
year if left
Yes.
unabated.
Yeah.
Therefore, WHO has embarked on this initiative, bring forward new ideas, new
Yes.
solutions,
Yes.
innovative and novel to combat our the existing health issues.
Yes.
And um, so in essence, that is the statistic, that is the research, our projections, and we ought to
Yes.
encourage people to
Yes.
bring forward ideas.
Yeah.
You know, what contributes to antimicrobial resistance? I can probably cite to you 8 reasons,
Yeah.
8 different, how can you say, mechanisms, problems that feed into the issue. It can start from the drug manufacturer,
Yeah.
from the pharmaceutical companies, the
Yeah.
effectiveness, the efficacy of the drug,
Yeah.
or our prescribing habits of
As
healthcare
medics.
professionals. Of
Yes.
yes,
The patients.
um, the end user, the patient, where we talk about patient adherence, patient counsel. As a medical practitioner, when you take a history from a patient, you ought to then counsel, right, on patient adherence. If it's an
Or
HIV positive
TB.
patient, you want to ensure patient adherence.
Mm.
Else, you will be feeding into the problem of antimicrobial resistance. In South Africa, you know, what we call the quadruple burden of disease, one being
Yes.
HIV and AIDS,
Yeah.
two being TB, right?
And then
Three
non-communicable
being
diseases and
the
injuries.
non-communicable diseases, for example, hypertension, cancer, diabetes, the cardiovascular related illnesses.
Yeah.
And four is maternal,
Maternal and
neonatal,
child. Yes.
child mortality.
Yes.
And really, the issue of antimicrobial resistance feeds into each of
Yeah.
these burden of diseases.
Yeah. All right. Let's move on. As somebody who's told me that, public health is your area of interest, and especially now that you've played a big role already, in multilateral forums and WHO. So another issue, um, this week, the National Council of Provinces approved the NHI bill, all right? This is following the National Assembly, which did the same, I think, around June, 13th of June. And before then, the Portfolio Committee on Health, I think it was the 26th of May. So basically, between the approval of the bill, that is the sign off by the president, and everything else, there is the issue of people being very unhappy about NHI, which is part of or our vehicle to take us to universal health care. Now, I just want to hear your view as somebody who is already looking issues not only within South Africa, but understanding, universal health care and the resolutions from the WHO. What is your opinion about the direction that our country is taking as far as NHI is concerned? And what is your thinking around those who are opposed to the implementation of NHI? We've got 10 minutes left here.
Yes. So the NHI it's a massive project that that the country, the Department of Health, is embarking on.
Yeah.
Quite interestingly, about 2 weeks ago, I briefly interacted with Professor Nicholas Crisp, who is the Deputy Director General.
The DDG. Yeah.
Yes, for National Department of Health.
Yes.
He's one of the, how could you say, I mean,
he's the driver of the NHI process. Yeah.
Absolutely, absolutely. He is rather, he brings forward over 3 decades of experience in public health.
Yes.
He's the one that is leading this initiative of NHI.
Yeah.
It's an initiative that we ought to support. It's an initiative that we ought to adopt because, as you said, the World Health Organization has put forward the agenda of universal health coverage.
By 2030.
I'm sure you, yes, by 2030. I'm sure you're quite familiar with the United Nations Sustainable Development Goals.
SDG 3.
17 of them.
Yeah.
Now, we are concerned with SDG 3 of good health and well-being. Of course, the other goals, they speak about poverty, about quality education, clean water, and sanitation. They speak about agriculture, about the wildlife, but we're concerned of goal 3, good health and well-being. Now, for good health and well-being, there ought to be, amongst others, the equitable distribution of resources. We need to ensure availability, accessibility of
Yes.
services to all, irrespective of
Of
color.
the one's ability to pay.
Yes, indeed. In South Africa, what is our situation? We have a public health system that is two-tiered,
Yeah,
meaning we've got the private sector, we've got the public sector.
indeed.
Now, the private sector uses over
Almost.
84%
Yeah.
of the funding,
No, no,
only servicing.
no, no. Private covers about 16% of people. Public
Yes,
about 84.
yes,
But in terms of the consumption, that 16% is taking almost half of the total budget. Well, the
absolutely.
annual expenditure by the country.
In fact, it's way over half.
Yeah,
So, as you correctly point out, the 16% in the private sector
yeah,
consume the majority of the budget, as
yes.
you say. And therefore, there has to be an intervention. There has to be some kind of mechanism that will ensure we are going to level the playing field. We will ensure equity. We will ensure we break down the barrier of
Of health
inequity.
inequity. Yeah, yeah.
Absolutely.
All
And
right.
in our case, it's
Yeah,
the NHI. You know, that's our tool. That's our mechanism to advance the agenda of universal health coverage. But
yeah,
of course, we recognize the challenges that come with it.
yeah.
One, how will it be funded? It's
Yes, the
estimated
detail.
in Yes, it's estimated it will cost the country over 500 billion rand per
Per
year.
annum.
That's one. Two, how, or rather, who will control the
Yes.
distribution of health services and its payment? Our
And the cancer of
politicians?
corruption as well.
Indeed, that's probably one of the biggest concerns, issue of corruption. It now opens the door because you're leaving the distribution of care in the hands of our politicians who
Yeah.
already have a bad reputation of corruption.
I mean, they
Three,
stole during COVID-19.
I mean, we've seen the incidents even at the Tembisa hospital that's in
Yes,
Gauteng.
with the skinny jeans.
I mean, just for the hospital, in excess of 850 million rands in corruption.
Yeah,
I mean,
one
for
hospital.
the for, yes, for the containers, it was quoted a container. It's an empty 5 liter container will cost you maybe 20 rand. It was invoiced at 10,000 rand per unit,
Yes.
and the corruption, it's
Yeah.
truly, I mean, you know,
Yeah.
but
But anyway,
but I think all, yeah.
yeah, let's move on because we've only got about 4 minutes. But I just wanted your opinion. You know, I mean, one thing that we haven't said there is that Section 27 of our Constitution, 27.1 says all shall have access to quality, affordable healthcare. But 27.2 says the government has an obligation to find reasonable solutions to ensure that there's no health inequity, meaning everybody must have access to healthcare. So it's a must. We must change the current situation. Both the private sector and the public sector are heading for disaster, and we need reforms, and we need them now. But maybe the issue is just the how, the engagement, but also the people who are in opposition. I think they need to also understand that the government has an obligation to govern. But anyway, the last thing I wanted to hear from you, many people are threatening that if NHI comes, they are going to emigrate. And they will leave, go to Canada, work in an NHI there in the rural areas of Canada. You know, do you think it's a knee-jerk reflex, or is it something that people are really going to do, you know, to leave South Africa because of NHI?
Yes. A serious concern, in fact, if you speak to the doctors, even in the private sector, the migration of healthcare workers. If you recall, when we had our Minister of Health, Dr. Joe Pashla, for the Living
Yes.
Legends event,
Yes.
Actually, one of the questions I posed to him is that, um, please take us into confidence, Minister. What is the solution to deal with the issue of migration of healthcare workers? And
Yes.
he says they are exploring that avenue. It's truly a concern, for the government, for the country. But I think ultimately it is a serious challenge.
It
We ought
is.
to ask the question: how can we incentivize? How can we reward our practitioners so that
To
they
stay.
remain in the country?
Yes.
Because if you train in South Africa, it can only be fair that you give back, you
Yes.
contribute, you serve your people. And it
Yes.
can't be that we lose our practitioners, our medical expertise, because of an intervention that seeks to actually
Actually,
improve the health situation in the country. So it's a
yeah.
major concern.
Yeah.
I would explore an avenue of
And
incentivizing,
case.
of
Yeah.
rewarding, our practitioners.
Yeah. And I mean, the developed nations, we can't compete with them, in terms of rewarding. But certainly, like you say, we could find innovative ways to make the people feel appreciated and that they are rewarded appropriately for the skills that they have, which are actually portable.
No, no, no. I mean, you are 100%. You are spot on,
Yeah.
because the skills and the expertise, the experience, the knowledge that these practitioners, it actually comes from us in South Africa, from the universities, our
Yes.
um, our our public higher education institutions, and therefore I think it's an injustice for the ones that we train will now want to leave us. And I
Yes.
think it's a serious concern. And I think even at the national level, this is being discussed, it's being debated,
Yes.
how we can address the issue of the migration of healthcare workers.
Yes. Well, we have come to the end of our interview. I wish I could have more time with you, Mohammed. But anyway, the 60 minutes just flew past like that. I enjoyed my conversation with you. And, to think the fact that, I only met you, I think, was it July? But already it's like we've known each other for long. But you inspire me, and I thought before I close, the year, I must have this interview with you before you do your final year, and maybe you're not available for interviews. So thank you very much, and thank you to everybody who joined in to listen to this interview. Any closing remarks as we wrap up?
So, it's an absolute pleasure. It's a privilege, an honor for me to be interacting with you. You are the one to be inspiring this next generation of practitioners. We can only be inspired by you, by your work, and of course the contribution that you have to the country. So the honor is all mine. And the issue of time is
Yes,
always the limiting factor,
yes,
especially when we're discussing critical issues of health. Time will
yes,
always be the limiting or the challenge, but we work
yeah,
around it. And
yes,
I'm sure that I will continue to feed off your inspiration, your motivation, your knowledge. I will always look to you. I will always seek your advice, your counsel, and ultimately your guidance as I embark on this journey of academia and of knowledge. I want to
yes,
thank you once again for this invitation. I want to thank your team for the sterling work to put this together. You know, um, it's truly it's been a wonderful discussion. It's been a wonderful interaction, quite eye-opening, quite stimulating, with a lot of
yes,
interest, with a lot of energy.
yeah.
And I thank you so much for that.
Thank you very much, Mohammed. It's definitely not the last time you are our guest, but for today, thank you very much. And another thank you to your parents who have given you space to be who you are. And I know I'm going to be following your career. I know you're destined for great things. And please don't emigrate.
Thank you so much for those kind words and that encouragement. I truly appreciate that. Really, I truly
Thank you very
appreciate it.
much. Thank you. Thank you to everybody who joined in. If you look at that kind of a young South African, it tells you that South Africa, here's the future. If only we can start appointing people in the right positions, people with the right agenda, people with the right skills, I think we'll get South Africa right. What do you think, Sipo? Yeah, my producer here is also a comrade, so that's why I'm asking what he's thinking, because he needs to go back and tell his comrades, you know what, I at the risk of being charged to be driving ageism, but I think we need to reduce the ages of people who are sitting in parliament, the ages of people who are in some of these positions to drive the future of our healthcare. The older guys on the other side of 70, they can be kept as the wise people, who guide the younger people. But anyway, that's just my idea. Thank you very much, Mohammed, and I'm sure we'll continue to interact. Thank you very much.
Very much indeed.
Thank you.